The Ion robot allows us to get into areas of the lung that were previously inaccessible to us or were only accessible by very high-risk procedures. In the past, our technology allowed us to go after somewhat larger nodules, somewhat closer to the center of the chest, and even then only acquire a diagnosis in about 60 or 70% of the cases. Now we can go through the lungs and we can biopsy these very small things that are sometimes the size of 1/3 of an inch, and do so with diagnostic accuracy that exceeds 90%. And with complication rates that are less than 1%. And so that's really exciting for us. A lot of the patients who we are diagnosing now with the Ion robot would have had to wait before, and we would have had to wait till their cancer grew substantially before we could biopsy it, or they would have to go through a biopsy that had a much higher risk of complication. The Ion has closed the doors on those complications, but opened the doors for diagnosis.